Can you tell me in your own words kind of what cultural competency means for you? And then also how can, maybe physicians who don't have a lot of experience dealing with, multicultural people from different backgrounds, kind of how they can inject a little bit of that into their practice and how they can move forward in caring for their patients?
Yeah, great question. I think cultural competency for me, I flip it and I say, it's not about the competency, it's more about the respect. So for me, it's cultural respect. I respect who you are. If you begin there, then even in my lack of fund of knowledge about whoever you might be, whether you're transgender, whether you're Jewish, or if you're Asian American, doesn't matter, because I'm approaching it from a perspective of respect. And then once you do that, that immediately opens the door. The patient begins to say, well, this person respects me. And because they respect me, I'm gonna open the door for them. And I'm gonna tell them things potentially that I had no plans of telling them, so I've had that. And so how do I do that? What is the mechanics of that? So sometimes it's literally having a regular conversation. And I know right now in the work environment that many providers are in, especially in the outpatient setting, we literally have 15 minutes, am I right? If not less.
Yeah.
If you think about the EMR and all the stuff we have to document and stuff. So you have to ask yourself, Dad, do I have can I add another 3 minutes to this? But you'd be surprised if you ask them a regular question. I'm talking about, oh, did you hear about Kobe Bryant? Oh, what do you think about this weather? I mean, if you ask them a regular question, all of a sudden you start to realize, hey, you two got something in common. And then they say, oh, they're connected to me now. And so now there's this sort of interplay, almost like a dance that happens. If you can imagine like a sort of a virtual dance. I'm not really dancing with my patients, of course, but there's a mental and emotional dance that's happening where I'm saying, I respect you, would you like to dance? And then they say, no one's ever done that to me. So they have so this person who's in this authoritative position, white coat, the whole nine, has these medications that are foreign to me, ask me to dance, or ask me about my day, or ask me, what is it like to live in California? I hear you're from California, tell me about that. And then you'd be surprised at what happens. And what happens in that dynamic, hopefully, is that patients share things with you and you establish a connection. And then all of a sudden, it's not foreign if you say, well, Ms. Jones, I think we're gonna have to change this medicine to this medicine. Before they'd be like, you're not gonna change, I just met you.
Right, absolutely.
Who are you? But now because we've danced, because we've established a mutual respect that people feel like, this person has my best interest. They're interested in me, and so, and I give them a reason why, and then I always end my visits with, is there anything else that we need to talk about today? And so, that's the dynamic of it, and to your point, that's a skill set, right? And that's just not about knowing the differential of hematuria or whatever, or shortness of breath. That's about knowing people and trying to gain some leeway, influence, because you can write 1,500 prescriptions. If that patient doesn't trust you, doesn't believe that you have their best interest, they're not going to do what you say. They might say, okay, I'm going to go fill the prescription, but I'm not going to take it. And so those are the things I think that more providers should do, even if they're not of the same ethnicity, that they could do that.